Hi, I'm Dr. Eli Whitney from the Heart and Vascular Institute of Texas. I want to talk to you about blood thinning, or what we refer to as anticoagulation, with a medication called Coumadin. Thinning the blood is a very important part of medicine and is very helpful in patients with the following: artificial heart valves, blood clots in the legs, blood clots in the lungs, congestive heart failure, heart muscle aneurysms, and atrial fibrillation. Anticoagulation definitely improves both the length and quality of life for many patients who have these medical conditions. Anticoagulation, however, can be dangerous to a person when the blood is made too thin. When the blood is made too thin, the patient is at risk of serious bleeding from even very minor injuries or bruises. On the other hand, not having the blood thinned enough can be equally or more dangerous, since inadequate thinning will allow blood clots to form too easily. For example, in patients who have artificial heart valves made of metal, blood clots will form in 30 to 70% of patients within 1 year unless the blood is properly thinned. This can lead to strokes, gangrene of the legs, or even sudden death. Patients who have atrial fibrillation have a 4 to 8% yearly risk of having a stroke when they are not receiving the medication Coumadin to thin their blood. For this reason, a delicate balance of blood thinning is necessary for all patients who take Coumadin. Different medical problems require different levels of blood thinning. Patients who have metal heart valves in the mitral position of the heart require the greatest amount of thinning. People who have metal heart valves in the aortic valve position require extensive thinning, but not as much as when the valve is in the mitral position. Patients who have congestive heart failure, atrial fibrillation, or blood clots in the veins of the legs or lungs require the least amount of blood thinning. The more the blood is thinned in general, the greater the risk of developing a complication from excessive bleeding. The way we check the thinness of the blood is with a test called the prothrombin time, or PT for short. A normal PT value is between 8.8 and 11.2. The greater the PT, the thinner the blood. There is a wide variability of, quote, normal for this test throughout the country. When Coumadin is taken, it thins the blood and makes the PT test number even higher. The greater the thinning, the greater the PT number. Traditionally, we have compared the thinness of patients' blood by comparing the PT number of the patient to the average PT number of the normal population. For example, if the PT of a patient taking Coumadin is 15 and the average of the normal population is 10, then the ratio of the PT of the patient to the normal PT is 15 divided by 10, or 1.5. This ratio is called the INR. The recommended ranges for the anticoagulation are to have an INR of 2 to 3 in patients with blood clots in the legs, blood clots in the lungs, or in those with atrial fibrillation. For patients with artificial heart valves, the INR should be between 2.5 and 4.0. 2.5 for aortic valves and 3.5 for mitral valves. The risk of developing a bleeding complication goes up significantly when the INR is greater than 4 for prolonged periods of time. The liver makes the proteins in the blood which are responsible for blood clotting. The liver needs vitamin K to make several of these proteins. Vitamin K is found in large amounts in green leafy vegetables and in lesser amounts in whole grains, beans, oats, and certain fruits. The vitamin K content of most meats is very low, with the exception of liver. This table shows the different amounts of vitamin K in various foods and is contained in your Coumadin handout. Of interest is the large difference in the amount of vitamin K in soybean oil compared with corn oil or olive oil. In addition, coffee has minimal amounts of vitamin K, while green tea has large amounts of vitamin K. When Coumadin is taken, it prevents the vitamin K from making the proteins that cause the blood to clot. The greater the amount of Coumadin taken, the greater the effect on vitamin K and the thinner the blood. Since the amount of blood thinning is so important for health, A proper balance between the amount of vitamin K eaten and the amount of Coumadin taken is necessary. When a person eats a lot of food, particularly vegetables and soybean oil, the vitamin K intake will be high. This person will need to take a large amount of Coumadin to counterbalance the large amount of vitamin K eaten. On the other hand, a small person who doesn't like to eat vegetables will not consume very much vitamin K and will require very little Coumadin to properly thin the blood. Since every person is different, the amount of Coumadin that must be used to properly thin a person's blood will be different. This is why we have a special Coumadin clinic to monitor therapy. The major problem with maintaining proper blood thinning is due to the fact that most people like variety with their diet. We may eat a salad for dinner every day for 3 days and then not eat it for another 10 days. This is fine for a normal person, but not for a person on Coumadin when the amount of vitamin K eaten changes. The amount of Coumadin taken must also change. Furthermore, it takes our livers several days to make the proteins that are responsible for blood clotting. Therefore, there is a delay between the vitamin K eaten and the thinness or thickness of the blood that the vitamin K produces. There are 2 solutions for this problem. The first solution is to totally avoid foods which have large amounts of vitamin K. In this way, even though the diet is varied, it will be varied among foods that have very small amounts of vitamin K. Therefore, there will be little requirement for Coumadin adjustment. The problem with this approach is that this diet will cause a person to avoid the foods that are good for the body in terms of controlling cholesterol, high blood pressure, and diabetes. The second solution is to have a regular pattern of eating. That is, do not eat at a salad bar for 4 days, then nothing but French fries and cheeseburgers for the next week. If you enjoy vegetables, eat them on a regular basis and in regular amounts. If you enjoy salad, eat it every day. The major problem with blood thinning with Coumadin is when the Coumadin is adjusted for one type of diet and the diet changes suddenly without any change in the dosage of Coumadin. When the amount of vitamin K changes, the dose of Coumadin must be changed or the blood may become too thin or too thick. The typical situations which cause problems are actually very predictable. Whenever you go on a vacation and eat in restaurants frequently, your diet will change dramatically, particularly if the restaurants use soybean oils for frying or soybean-based margarine, which has much more vitamin K than corn oil-based margarine. This change in diet will produce a change in your blood thinning. Whenever you go on vacation, be sure you get your blood checked for proper thinness at least 1 to 2 times per week. In this way, you can adjust your Coumadin to maintain the proper balance between your diet and the amount of Coumadin you take. Another situation which produces problems are when certain vegetables or fruits are in season. Some vegetables and fruits have a lot of vitamin K, strawberries for example. When they are in season, relatively cheap, and very tasty, they may be eaten to a much greater extent than normal. When this takes place, the Coumadin dose may not be adequate and harmful clotting occurs. Other patients have gotten in trouble when they join the Diners Club. When you're a member of the Diners Club, you're given coupons to eat at many different restaurants for markedly reduced prices. This variety in eating caused by eating at different restaurants several times a week totally prevents regulation of Coumadin. The most important facet of regulating Coumadin is to regulate your eating. Another important aspect of Coumadin and regulating blood thinness is the interaction with other medications. Coumadin is bound, that is, becomes attached to many different proteins in the blood. Because of this, only a small fraction of the Coumadin in a person's blood is actually free or not bound to the blood proteins and thereby available to thin the blood. Many other medications are also highly bound to blood proteins in much the same way as Coumadin. There are, however, only so many places for these medications to bind themselves to the blood proteins. As a result, when a person is regulated on Coumadin and starts a new medication which is also protein-bound, the new medication will bump some of the protein-bound Coumadin and convert it to active Coumadin, which will thin the blood an extra amount. As a result, even though the patient is taking the same dose of Coumadin, the blood will become very thin and the INR, or PT level, will increase dramatically. This will make the person much more likely to suffer a bleeding complication. In a like manner, a person can get into trouble when a medication gets stopped in a person who has been regulated with this Coumadin. When a medication which is highly protein bound gets stopped, the activity of Coumadin can be dramatically reduced. This will cause the blood to become much thicker even though the dose of Coumadin was not changed. A typical example of this occurs when a patient on Coumadin is started on the common antibiotic Ampicillin to treat bronchitis. Ampicillin is very highly bound to blood proteins. When it is given, it activates the Coumadin and makes it free to thin the blood. As a result, the PT level and the INR can dramatically increase and increase the risk of bleeding. When a person recognizes the increase in blood thinness, the dose of Coumadin is appropriately reduced. The ampicillin, however, is generally only taken by the patient for 10 days to 2 weeks. When the ampicillin is stopped, the number of binding sites for Coumadin will suddenly increase. This will inactivate the Coumadin and make the blood too thick. The way to handle this problem is simple. Whenever you go on any medication, have your PT level and INR checked twice a week after you start the medication to see how your blood thinness is doing. When you stop a medication, do the same thing. Many patients and physicians think that patients on Coumadin cannot take arthritis medications. This is not totally correct. You can be on Coumadin and take arthritis medications, with the exception of aspirin, if you take the arthritis medications regularly. Furthermore, you must have your PT and INR checked regularly to be certain that your blood is properly thinned. The problem occurs when you don't take the medications regularly, or if you take aspirin, which is a stronger thinner of blood than most of the other arthritis medications. There are, however, certain medications which do not interact with Coumadin. Perhaps the best known is Tylenol for pain. Tylenol does not interfere with Coumadin, and for this reason is preferred over aspirin and many other arthritis medications, with the possible exception of Nibuditone or Relafin. Nibuditone or Relafin does not affect the PT value whatsoever. It likewise does not affect the clotting of blood and has the lowest incidence of ulcers of any of the arthritis medications. Because of this, many arthritis experts recommend that this medication be used in Coumadin patients with arthritis. Another problem with Coumadin occurs when a person starts or stops an exercise program. Frequently, the amount of food eaten changes. When this occurs, the amount of vitamin K eaten will change. This will influence the amount of Coumadin that should be taken. Another way a person can get into trouble is during the preparation for various medical tests, such as a barium enema. When preparing for a barium enema, a person goes on clear liquids for 2 days. During those days, no vitamin K is ingested. If a person stays on the same dose of Coumadin, the blood can become too thin. The bottom line with Coumadin and blood thinning is that you must regulate your eating, your exercise, and your medications. Unless it is known for certain, you should presume that any medication you start or stop will influence your blood thinness. This is the safest approach. Any change in your diet, exercise program, or medications will influence your blood thinning balance. I hope this educational video has helped you understand the importance of Coumadin and the role it plays in keeping your blood thinned. If you have any questions, please feel free to call me. I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas.